My name is Dr. NEZAMI. The purpose of this educational awareness video is to bring knowledge and awareness to the public, specifically patients who are suffering from cancer, their families and their relatives, the people who are at risk for cancer, and normal individuals. The patients who are suffering from cancer at any stages and levels, from the time that you are diagnosed with cancer to the time that you are suffering from the side effects of toxic treatments. Please understand, our understanding of biology of cancer has changed. In the last decade, as physicians, we have been able to understand that the cancer biology is different than tumor biology. For the longest time, as a physician, we thought that cancer and tumor are the same thing. Now we know that cancer and tumor are totally different things. The treatments that were commercialized and available in clinics provided by the oncologist target the tumor. As we speak, there is no effective treatment that targets the cancer stem cells, which are the behind-the-scene players, which are the cause of the tumor recurrence, which are the main cause of patients' death. The reason that we lose every 30 seconds one person with cancer, and the reason that cancer is becoming the first very cause of this death in the whole world is exactly that. We as physicians and scientists have failed to apply the scientific merits that we have realized in the last decade into the clinic. As a result, patients are suffering, they're losing their life, and they are going through a very difficult time because we unfortunately have played politics. My message now is to realize that it's the time for change. It's time to apply the science. It's time for a breakthrough to apply what we know called translational science into the clinic. And the message will also provide educational awareness to the public about their choices, about their options of care that includes very least toxic to non-toxic treatments over very toxic and potentially detrimental treatments that are available. Currently, chemotherapy, radiation, and surgery are the only three methods of treatment of cancer. If you are diagnosed with cancer anywhere in the world, your options include these three methods. Unfortunately, as I mentioned before, these three methods only treat the tumor. They do not address the disease itself. The mother cells, the cancer stem cells behind the scene, they are not touched by these methods of treatment. I have good news. I am bringing hope and awareness by this video because we have realized that there are natural treatments that are extremely effective and they target cancer stem cells. As we speak, there is no commercially available treatment for stem cells. Unfortunately, patients continue to suffer as a result. We are aiming at providing treatments at a larger scale, especially in the Middle East. People of the Middle East are suffering more and more because of cancer. The incidence of cancer in the countries such as UAE has doubled in the last few years. The rate of cancer incidence has increased from 10 to 15% to 10 to 15 in 100,000 now to 86 in 100,000 population. All the efforts that have been faithfully performed and ordered by the government in this regard, including 2021 health agenda, has failed. Unfortunately, the agenda was aiming at reducing the cancer incidence by 2021 by 18%. This not only didn't happen, but also the incidence increased. My opinion as a physician and a scientist in this field is that we are going to the wrong direction. The investments that are done in pharmaceutical companies have not helped. The investments that have been done in creating new hospitals and big institutions only attract more patients instead of providing true healing and true meanings of healing. My suggestion and my proposal to patients in general is to become self-advocate of their own. They need to understand their options. They need to realize there's no one to help them except themselves to understand their options. They need to educate themselves and not be a subject for pharmaceutical companies' experimental drugs, which mainly fail in this area. The reason that I am promoting and advocating for such change is because I see responsibilities as a human being to the others. As a physician, I had an oath, and in my oath, I made a promise that I will help to save patients' lives no matter what. I will fight with any mainstream concept that is wrong. One day we believed that the world is flat. The same day we believed that chemotherapy is the answer and solution for cancer. Now we know that the world is not flat and chemotherapy is not the drug of choice when it comes to cancer. In fact, scientific evidence prove that chemotherapies in general, specifically certain types that are first line of treatments, meaning that mostly used for very common types of cancers such as breast cancer, not only does not improve patient survival at certain stages, but also it increases the tumor dissemination. These chemotherapy agents may shrink the tumor, but in a very short period of time, the tumor spreads and it involves major distant organs when the patient is diagnosed as stage 4. Unfortunately, every oncologist and unfortunately every provider blames the cancer for what happens to patient at the end. But the reality is that patient suffers and dies because of the treatments. These treatments harm the patient more than help. As I mentioned before, the dissemination of the disease is aimed and done through the cancer stem cell activation. Every time that the chemotherapy or radiation is used, the tumor daughter cells, the tumor cells can disseminate. They can become activated. The solution to this problem is to use treatments that stop the disease from progressing by stopping the tumor from dissemination, reducing the cancer incidence, prevention of cancer from beginning, risk stratifying and finding out who is at risk from cancer development and stopping that from beginning. Even when a patient is diagnosed, the solution is to find out the ways that you can stop the stem cells. The sooner the better. When a patient has a stage 4 disease, it is not too late. Cancer is not a death sentence. This is my message. Unfortunately, oncologists do not have the courage or compassion or the scientific understanding of what needs to happen most of the time to help a patient. Some of them are very compassionate. Some of them really want to help the patient and they do their best, but their tools are lacking. I am bringing the message of hope and healing. I am hopeful that the audience of this video will spread the word to each other, to the families, to the relatives, to the patients involved, to the ones that are suffering in the hospital, to the ones who are concerned about their future, to the ones who are concerned about their children. Are they going to be at risk? What can I do to prevent cancer from happening? Unfortunately, cancer is a product of our unhealthy environment. The environment that we live in creates a situation biologically for the cells in the body to respond and reflect, trying to repair the damages, trying to protect each other and reproduce. This is their attempt to defeat the damages that they create cancer. The cells do not know that they are doing this in the wrong direction. They think that they are repairing, but this repair goes beyond control. In other words, cancer is an adaptation to an unhealthy environment. So if we cannot change the environment, we have to start working on the cells to help them repair in a healthy way. So prevention is the mainstay of reducing the risk of cancer and reducing the challenges that comes with the disease. In order to prevent cancer, there are specific protocols that I have developed. These are much more advanced and much more ahead of time as far as clinical approach that you see on a day-to-day basis in clinics. Of course, screening methods such as mammographies, colonoscopies, and whatnot are important. But these tests that I have developed over the years and the technologies that we have developed and used successfully in our clinics in the United States for over a decade has proven not only to be effective on treatment of cancer patients, but also to prevent cancer from beginning, called primary prevention, and from recurrence, called secondary prevention. By using these approaches, patients have a peace of mind that when their cancer is treated and they accomplish remission, the cancer never comes back. In hundreds of patients that I have treated over the years, the risk of cancer recurrence has been almost zero. I do not recall one single patient that after accomplishing remission, their cancer has returned. Why? Because we address the cause of the disease, the root of the disease, not the symptom. If the tumor is the symptom of disease and the cause of the disease are cancer stem cells, we target the cause. Going after the tumor, which is the symptom of disease, and treating it with chemotherapy, radiation, or surgery always fails. Unfortunately, the information that I'm just bringing up is far beyond what is practiced in any major institution, academic institution, government hospitals, and whatnot, because there are so much financial interest in manufacturing and selling products that only go after the tumor. Surgeries are expensive. Radiation technology and equipment are expensive. And so is chemotherapy. The therapies that I promote for are not expensive. The therapies that I'm telling you about are not expensive. Mainly these therapies are made from natural compounds. They have been used for decades and decades in different formats. What we have found is to find what doses of what natural compound at what concentration is able to treat what type of cancer at certain stages. We have spent over 10 years of doing research to exactly find that. We have spent a lot of resources and a lot of time to be able to come with the protocols that we confidently can use in patients harmlessly and with superior results. I'm not here to market any treatment. I'm not here to sell any products. Patients come to see me in California, in the United States, from all across the world. They travel from Asia, Europe, Middle East. They are all referred by their oncologist, by the way, many times after their toxic treatments have failed. They have no other option, and patient is not ready to give up. They ask, what else do I have as options? And the oncologist tells them, there is a guy in California that might have a solution. I hope and I wish that these patients are referred to me sooner before they have only weeks to live. But unfortunately, they are referred to me usually at very advanced stage when they don't have more than a few weeks to live. And still, we are able to turn around the table in many cases. But it would be great if we can apply this treatment sooner. I'm not here to compete with any pharmaceutical companies. I'm not here to take business away from any hospitals. But I'm here to help them, or I would say whoever has two elements in their personality. This is not something that a doctor can teach or learn in a school. Courage and compassion. And if they have that trait in their genes, if a doctor goes to medical school to help another patient, they should listen to me, because this is time for a change. This is a time that I have seen many oncologists come and admit, I have buried enough patients. It's time for me to learn something new. It's time for me to save somebody's life. So when I celebrate my birthday at the 60th year of age, I see patients attending. This is a hope that I have, and this is a hope that providers such as oncologists should have. Financial interests are important, but I think there should not be the priority. We did not go to medical school and we did not make the oath to make money. As a result, I can tell you, I have created a foundation. Patients who do not have money, patients who cannot afford treatment, they are supported by my foundation. Everybody is treated the same way. We do not close the doors to the ones who cannot afford. Yet I have patients who are very wealthy and they support the foundation. When they are treated and they get miraculous results, they have no reservation of writing checks and supporting hundreds of other patients that are currently treating for free. They are coming either in the clinical trials or off the trials, and they are treated for free. This is my pride, and I stand by it. I'm also prideful because I did not sell myself cheap. I always started looking at my mission. And my mission from beginning, when I started doing research on finding solution for cancer patients, was only one thing. When somebody reaches out and asks for help, you would say, I can. Thank you very much for listening to this video, and I hope that the discussion continues.